In some parts of the Volta region of Ghana, the three-wheeled tricycle, popularly known as aboboya or motokin, is the surest way of accessing emergency medical services. In some instances, the people would have to travel long distances on deplorable road to access healthcare. But with the introduction of the Zipline medical delivery services, some of the communities in rural areas are now able to receive quality medical services in time. Sister Jifa processes Gary at Poviaji in the central town district of the Volta region for distribution in some urban communities. She tells Citi News in the past she would have to travel for over an hour to Akachi in the Akachi South Municipality to access quality health care. But the introduction of Zipline has reduced the stress.
Oh, you should come at your agua. Now you go fun, not to come and get fun.
Kechande.
Chaela, no ye are. Although you are grabbing, I can live by you. Akachi.
This is the Poviaji Chips compound, and this is their motokin ambulance. We serve some rural communities here in Central Tong. Aishana Kwama Ankra is a health practitioner here at the facility. She tells Citi News, healthcare delivery has been a challenge at their post since the breakdown of the tricycle. She, however, says the introduction of Zipline medical delivery has positively impacted the work of health professionals in the area.
The health delivery in this area, it's not easy. It's not easy, especially with the network. It's not easy. And even we don't, that was last 3 years, we didn't even have pipe. So sometimes we have to carry water. The nurses, we carry water. We go to the riverbank, carry water on our head, and then we bring it to the facility. We use them for delivery or sometimes for hand washing. So sometimes when delivery comes impromptu, then we have to carry gallons, go and fetch water for the delivery. It is not easy. Or sometimes you get someone to fetch it. When a person fetches, he takes 1 gallon, 50 pesos for 1 gallon. And we don't have that money. So we use our own money and then we fetch the water. Whenever we get a delivery and we have to refer the person to Akachi, that's where we refer. Then we use the tricycle and then
to convey the
person
to labor.
Yes. Ours has been, there is a fault at where we put the petrol, the tank. So there is a fault, that's why it's not in use. The LMD, we request every 3 months. So after they deliver, if you need another drug, you have to wait for the next 3 months before you get it. But when Zipline was introduced, things have been very easy. When we are in shortage of drugs or medicine, we just request and within 30 minutes, we get them. But previously, we didn't get any drugs, so we normally refer them to the higher facilities. But since Zipline came, now our referral has reduced. And we are feeling comfortable with it, reliable, convenient.
The district health information officer for Central Tong wants the services to be extended to other deprived areas.
So previously, when let's say there's a snake bite in these communities, it will take a very long time for the facility to refer from this area to the regional hospital for the person to be provided with care. But then once Zipline came on board, within a very short period of time, within 10 to 15 minutes, an anti-snake is delivered to these facilities that are located in remote areas, and then it is provided to this to the client who has been bitten by a snake. Where the facility is located, in fact, they actually need it because it's they have to cross like 2 or 3 rivers before you get to that facility. So our major concern is that they should bring that facility on board for now.
Which facility is it?
Ugaji Chiefs. So once they bring that facility on board, I think it will be very, very helpful for us. For now, they deliver to a nearby facility.